Ladies and gentlemen, I'm deeply honored to stand before you today as a speaker at the Regional Forum of the Arab Network for Early Childhood. I extend my heartfelt gratitude to the organizers for inviting me to be a part of this significant gathering, which focuses on a cause that is close to UNICEF's mandate and heart, the well-being and development of children. In the heart of the Middle East and North Africa region, a profound transformation is taking place, one that is shaping the future of millions of young lives. Early childhood development, or ECD, is at the core of this change. It lays the foundation for children's success, emphasizing that every child deserves a strong start in life, ensuring that well-being and future contributions to society. In the MENA region, home to over 100 children aged 0 to 8, we encounter diverse socioeconomic contexts across 20 countries. Yet, these nations share common challenges, including conflicts, crises, and varying stages of development. Despite the immense potential, ECD progress in MENA has faced hurdles. Low investments and inadequate reforms, combined with conflicts and other challenges, have hindered the region's efforts. But the statistics paint a hopeful picture. Between 1990 and 2021, neonatal and infant mortality rates were reduced by more than half, while under 5 mortality dropped significantly. Still, disparities persist with varying rates among countries. Disparities in healthcare access and child health outcomes persist. Rural and remote areas often face high risks of child mortality due to limited access to health care facilities and trained professionals. Food poverty is another challenge. Approximately 66% of children aged 6 to 23 months experience food poverty in MENA, with severe food poverty affecting 1 in 4 children under 5 years in some countries. To gauge ECD progress, we use key indicators such as access to healthcare services, including antenatal and postnatal care, varies across MENA countries. Immunization rates have seen progress, but challenges persist. Access to basic services like drinking water and sanitation varies within the region, with challenges in some countries. Literacy and numeracy development varies among countries, reflecting the need for tailored approaches. Home learning activities play a crucial role. Participation rates differ significantly among countries, impacting children's cognitive development. Positive parenting is essential, yet sociocultural values and traditions influence parenting practices. There is a need to bridge the gap between beliefs and positive parenting principles. Children with disabilities deserve early intervention and care. Unfortunately, they often receive less stimulation and responsive care, hindering their development. Early childhood education is vital, but the MENA region faces lower attendance rates compared to the global average. Access to pre-primary education remains a challenge in conflict-affected areas. So what can be done? Mobilize key stakeholders, such as policymakers, academia, professional associations, networks, parenting organizations, communities, and so on, to expand ECD conversation and understanding at the subnational, national, and regional levels. Develop multi-sectoral ECD policies, strategies, and costed action plans driven by evidence and data collected and analyzed consistently and regularly with a leading ECD governance body. Establish quality assurance and monitoring mechanisms to track progress and increase the accountability of government institutions. Support the development of key stakeholders on ECD planning, costing, data collection, data analysis, and implementation. I cannot stress enough the importance of partnership. The Arab Network on Early Childhood is a relevant partner in addressing the earlier mentioned issues. For instance, with the Arab Network, UNICEF, WHO, IRC, and Save the Children have been partnering on advancing the ECD agenda at the global and regional level for several years now. We have been successfully engaged in our joint efforts in promoting the operationalization of nurturing care framework in countries affected by humanitarian crisis in our region. National ECD task teams have been created in Iraq, Palestine, Syria, and Jordan, and supported to carry out national workshops that brought together multi-sectoral partners and stakeholders who discussed and agreed on countries' priorities and key actions to advance nurturing care in their specific context. We have also been working in collaboration with the Arab Network in promoting parenting in the region under the umbrella of the Global Initiative to Support Parents. The initiative, initiated by UNICEF, the World Health Organization, Parenting for Lifelong Health at the University of Oxford, the Early Childhood Development Action Network, and the Global Partnership to End Violence Against Children. Specifically, a regional 3-day virtual conference took place discussing and sharing interesting initiatives, programs, and platforms that promote parenting to ensure health and well-being of children and adolescents in the region. Therefore, bringing key stakeholders, partners, and engaging networks in this kind of a format and forums is one of the important strategies that are vastly needed for our region. Together, we can make a difference. By investing in early childhood development, we ensure that every child in the MENA region has the opportunity to thrive, contributing to a brighter future for all. Once again, I thank Arab Network on Early Childhood for privilege of addressing you all today. I'm sure that there will be engaging and fruitful discussions, learning from each other, and collectively striving for a future where the rights, happiness, and well-being of our children are at the front of our priorities.